Good evening. Thank you for joining the Mono County COVID Community Meeting for April 30th, 2020. My name is Brian Wheeler from Mono County Public Health. I'm once again joined by panelists from Mono County, the town of Mammoth, and Mammoth Hospital. Before we get started tonight, I do want to remind everyone of our COVID-19 portal, which is in English and Spanish, and that website is monohealth.com/coronavirus. You can visit the site for the most up-to-date information. There's a community survey that's on the site that I encourage everyone to take. There is also a FAQ page where a lot of your questions may be answered. And I encourage everyone to view the Path Forward Reopening of Mono County, which is also on the homepage. And as a reminder, there is the nurse hotline. If you dial 211, you can speak to a nurse between the hours of 8 and 5 if you have questions regarding coronavirus or if you feel you may have symptoms. So we have a lot to get to tonight, so let's get started. Our first area will be a review of the Path Forward Reopening of Mono County and economic recovery. Our panelists for this will be Dan Holler from the town of Mammoth Lakes and Bob Lawton from the county of Mono. Dan, Bob?
Thanks, Brian. And it's been a pleasure working with you and a pleasure for the county to work with Dan and the crew from the town on this most important aspect of our response to the coronavirus. We make up, the town and the county and shared staffs, the local COVID-19 Unified Incident Command Team. We are committed to opening our community, all of our communities from Colville to the Inyo border, opening them safely, responsibly, and in a measured fashion to avoid a potential resurgence after all of the sacrifices we have made to get this far. Now, the Incident Command Team has developed a strategy in collaboration with representatives of the hospital, representatives of our various business communities and chambers, the economic drivers of our county. We're finalizing those plans. We can't implement those plans or any plan ahead of the state of California and the governor's shelter-in-place order. And for those of you who think that we could do better and that the state could move a little bit faster, contact Governor Newsom. His phone number is 916-455-2841. You can email him at governor@governor.ca.gov or gavin.newsom@gov.ca.gov, and we'll probably work that in a little bit later in the show. But seriously, we want to get as close to the limits as possible, but the governor is treating the entire state as if it were all the same. Our Board of Supervisors will be taking action on Tuesday, May 5th, to encourage the governor to look at risk and look at outcomes in determining how far we're able to go. So Governor Newsom, the state public health officer, they've issued the order. We are legally obligated to follow it. Every county, every jurisdiction within the county, we don't have authority to overturn that order. But we recognize that economic health is vital to the sustainability of our community. We know how hard it is for people in Mono County, in Inyo County, everywhere throughout California and the United States. We are working with our business community to ensure that when the governor lets us go, when the governor takes his foot off the brake, we will go as far and as quickly as we legally can go. And we will do so safely. We're going to preserve our community's health. We are determined to mitigate the possibility of a recurrence of COVID-19 in our community. And we ask our residents and our businesses to take the long view as well as the short view with respect to how we engage each other, and how we bring our economy back. So with that, I'd like to defer to Dan. I know that we had updated the community earlier this week, and I'd like to have Dan pick it up from there.
Thank you, Bob. Yeah, as Bob mentioned, we have gone through a lot of work in preparing and prepping for when the governor allows us to open up our community. We have been very pleased with the actions taken by our community over the last several weeks. You're to be commended. The spread of the COVID in Mono County has been held low. We still have some incidents, but we've done a great job. Other places in the state have larger challenges still, and so we're still monitoring not just what's in Mono County, but the areas around us. But given that, we are also beginning to work with local businesses, looking at opportunities, a lot of work on preparing for when we can open, and how do we assist businesses. One of the steps we will be taking is to begin working with a group of businesses, kind of a representative group, again, to what is the actual assistance that we could actually provide today that could help businesses, as well as the work that's ongoing through our economic recovery branch for the standards and elements that may have to be in place for businesses to open once we're allowed to. So I think we've done a lot of great work. There's more to come. Watch for information coming out. And as we begin to outreach and say, what can we actually do? What steps can we take to help our businesses? We want to be very intentional about that, very similar to what we've done with our rental assistance program for individuals and other efforts we've made to make sure our community is protected. Now, how do we step up and really come alongside and look at how do we help our local businesses? We've had a number of different presentations and information on kind of that step forward, but look for information to come out on that here end of this week, beginning of next week, to give you an ideal of what businesses we'll be looking at as we look to get to opening. We're also trying to track that and follow along with the governor's direction and that order that we're obligated to follow. And so we'll be speaking to details about that as well, but that's kind of our guideline, as well as our own efforts to make sure that we are making decisions in line with the data that we have that ensures public health. And also an overriding theme through our work is that we don't have a resurgence of COVID-19 into the future, is that we believe would be worse on our economy than the current situation we're in today. Thank you.
Thank you, Dan, and thank you, Bob. Our next topic will be Mammoth Hospital. So can we have Dr. Burrows? Can you speak?
Yeah, thanks, Brian. Good evening, everybody. And let me start by saying, again, a very heartfelt thank you to everyone in Mono County, our visitors, our second homeowners, for everything that we have asked you to do that you have done. Because of what you did, you stayed away, you obeyed the shelter-in-place order, you did social distancing as well as you did. I think it's fair to say we didn't just flatten the curve in Mono County, we crushed it. And that was exactly our objective. And because of everything you did, you gave us the opportunity to be as prepared as we are for not only taking care of patients throughout the biggest scare of this thus far, but also moving forward in our ability to take care of everybody. And I can't thank you enough. Without those measures, we would be looking very much like all the other major metropolitan areas across the country and frankly throughout the world that have just been completely impacted by this, to the point where they are literally drowning in patients coming into their healthcare facilities. We are not, and that is all because of you. Our objectives from the hospital, as much as I would love to tell you, is to tell the town go ahead and open, is not that. Our objective is to keep everybody safe, and we have some pretty fixed, defined areas that we're looking at. One is to be able to take care of everybody, which right now I'm very happy to say we are. The capacity for the hospital to take care of patients is absolutely 100% able to do so without any limitations, any concerns, any decisions that would have to be made. Are we going to take care of this person as opposed to this person? That is not our situation. I'm delighted to tell you that. Another objective we had was not to be a vector. What that means is that for employees and healthcare providers that are taking care of patients in the hospital, we are not spreading the disease. So healthcare workers are not getting sick. Patients that have to come in and be seen either in our clinics or in a hospital setting or in the emergency room are not getting sick. They're not contracting the virus because they're there. And then lastly, and equally as important, is doing everything we can to avoid a surge, where we're now in a situation where we are completely overwhelmed and overloaded, and we are in a crisis situation where we simply don't have enough personnel or resources or personal protection to take care of ourselves and patients and the community. So we have met all of those objectives. I'm confident in telling everybody listening that from a hospital perspective, from the ability to take care of people, we are very much ready to move forward. That is a crucial part of the plan to do that, to do just that and move forward. But it is not the only part of it. It is obviously listening to the governor, following the rest of the state, working in cooperation with everybody on this committee and throughout the town to make sure that we are all on the same page as we move forward, and that we're not moving in some sort of a jagged pattern where some of us are moving, some of us are not. And that's the way we're going to be successful. As far as testing is concerned, this is a part of our objective to be able to move forward. We need to be in a position where we can test everybody we have to test in order to meet the governor's requirements to move forward. Right now, testing is still very much in the position of people that are sick getting admitted to the hospital, people that are healthcare workers that we need to make sure have not contracted the virus so they can continue to take care of patients, and then people being referred by the public health department as part of a tracing program, which means that if an individual gets sick and they have COVID-19, we can do traces on immediate household members or immediate contacts and try to identify people in the community and in their house that might potentially also be infected, symptomatic or asymptomatic. This allows us to isolate them if they're positive, quarantine them if we have a suspicion that they're infected, and contain the virus and not let it spin out of control. And we are also very fortunate to be in a position where we can do that 100% of the time right now, as opposed to other parts of the state or the country where frankly testing is a huge limitation and they don't have that ability. So we count ourselves very fortunate that we are in that situation right now. If you feel that you are either sick or you've been in contact with somebody, as Brian Wheeler has mentioned, please call the 211 hotline. You can speak to a nurse. If it's felt that you need to be tested, we can in fact test you. And certainly if you're sick and need to be admitted to the hospital, we are very much in a position where we can take care of you in a hospital setting.
Thank you, Dr. Burrows. I accidentally skipped over Chief Frank Freebold, who's going to speak to us about the California Resilience Roadmap stages. I apologize, Frank. Are you there?
No worries, Brian. I've been off queue several times this week. Thank you very much. All right, and thank you all for joining us this evening. I know you've got other things you could get out doing this nice weather, but appreciate you listening in here. I just want to cover, if I could sum up one thing I'm going to address here in the next couple of minutes, it's intent. We are at a transition in the management of this incident for our county. It's been very clear up front what we had to do, and as Dr. Burrows said, this community, this county has absolutely crushed the expectation. People were writing rules about what we needed to do, and you more than met those. So you've earned the right to be in a position to have a resilient start, to get going as quick as we can, as Bob had mentioned. One of the things that's causing us in this transition, right? Anytime you're in transition, there's some gray area. What we have right now, very specifically, is two things that are causing some confusion out there. I've been on the phone all day long. I know Dan has, and we will be for the next few days to come. The governor has discussed these 4 stages of resilience, and he made it really clear that we're weeks, not months, weeks away from stage 2. Now, stage 2 is a gradual reopening of some of the lower risk workplaces with adaptations. retail, manufacturing, offices, where you can't telework, some more public spaces. That's what phase 2 looks like. He says we're close to that, but we're not there yet. One of the things that's a little tough right now for us is 2 days ago, Governor's office also released an updated list of essential critical infrastructure and workers. And as you drill down into some of those, we're finding conflicts between what's in that list, the governor's list, and what he defines in stage 2. So it's not the first time we've had ambiguity in regulations and guidance. But instead of focusing on those differences, we're going to get there. We really want to focus on intent. And you can and have already done this by exceeding the public health intent at the beginning. You bought into the idea that we needed to get our community down to base population. That gave Dr. Burrows and his team a chance to get the hospital ready to handle patient surges that they were facing. He gave Dr. Boo and Brian a chance to get public health squared away so that they could handle the contact tracing and the testing that we're doing now. He gave Kathy Peterson the opportunity to get the community support branch ready to support countywide the needs that we had out in the remote areas of the county. And so you've let us do that. And what we're asking here is, please help us meet the public health intent, even if there is a little bit of ambiguity right now in this, the stage we're in versus, some of the documentation coming out. It is our intent, as Bob said and Dan said, it is our intent to get ourselves back to an economic reopening as fast as we possibly can while avoiding 2 things. The first one is we can't have a resurgence, just as Dr. Burrows said. And we have some risk for that because we know that our very economy comes out of Southern California. They did not have as much success in crushing this curve as we did. I think you would all agree that a lot of our tourists lack some of the discipline that we have in their Eastern Sierra. So we need to be ready for that. The second thing that we can't do is get out too far ahead of the state. And it's not just about being rule followers. We are currently engaged in applying for large amounts of public assistance. Now, I do not want to have us be in a position where grants and federal funding and support can become in jeopardy because we're flaunting violation of the governor's orders. It would be unfair to you. I wouldn't be a good manager if I did that. So for the rest of the time here that we have, please understand intent. Our intent is to get you back to normal as fast as we possibly can without a resurgence, which would be devastating, and without putting ourselves at risk to either extend the current rules we're under by getting too far out ahead of them, or putting some of the reimbursements, significant reimbursements that we have in the pipeline to help us out financially. So we know you can do this. You have more than met this at the front end. That's why we were so successful crushing this curve, as Dr. Burrows said. Hang in there with us for just a few more weeks. We're weeks, not months away. Let's not spoil the work that we've done. And the last thing I'll say is that when people do come up, everybody likes to pretend they're a local here from Mammoth, right? From stickers on their bumper to, maybe catching some local T-shirts. Let's kind of show them how to be a local in this sense. We need to take care of our community. So, the masking, the social distancing, all those things we've learned how to do as we begin to reopen, really meet that intent. Be a good example for the people that are coming into town so we can get them to behave the way we need them to do to protect ourselves and our community and still get back up and open. So thank you, and let's go for good intent.
Thank you so much, Chief. Our next topic is Town and County Rental Assistance Program. Dan, Bob?
Yeah, this is Dan. If I can start off with the town rental program. We had set up a partnership with Mammoth Lakes Housing, and we provided $200,000 as some initial funding to support rental assistance in the town of Mammoth Lakes. The Mammoth Lakes Housing website is mammothlakeshousing.org. Go on there. The application is there. There's information. We've also received donations from some private individuals and from First Five First five, funding can assist families with children under 6. Some of the private donations can be used in a broader sense for the program. I'll let Bob talk to the elements that the county is working on to be set up, but that is the initial rental program that's out there. We are also looking at a community development block grant funding that we may be able to access within the next month or so that would add another $70,000+ to the program. That may be a little more restrictive in its use based on federal guidelines, but it will still be available to the majority of people in need here within the town of Mammoth Lakes or into Mono County for some of the block grant money. So that program is up and running. We've got several applicants in. We encourage people to, they can go online to that. If you can't do that, you can call, or if you come by the town offices, we will have a hard copy of the application that people can pick up outside of our offices. Thank you.
And thank you, Dan. And let me say how much we appreciate the town's leadership on this. County of Mono, very early on in this, went to the state to discuss the repurposing of a portion of our whole person care funding used for homeless services. And we are going to be redirecting about $150,000 in those funds toward a rental relief program, and leveraging those funds to, we'll leverage those funds toward contributions from private residents and from local foundations. It is our hope to, similarly to the town's partnership with Mammoth Lakes Housing for administrative purposes, we'd like to do the same. We'd like to have a parallel program for the county, with our initial priority, making sure that we meet needs in the unincorporated areas of the county. But to the extent that there are funds remaining after that, after those needs are met, is to go right in and work with the town. So those are funds that are available in the short term, in the near term, when we know people are severely in need. For the county, looking forward, we've got a $500,000 HOPE grant through the state and from the Federal Department of Housing and Urban Development. And we're earmarking, we got authorization from the Board of Supervisors last week to revise our application to repurpose $300,000 of that $500,000, which would otherwise be used for home buyer assistance, to repurpose $300,000 for a rental relief program. And as soon as that application receives approval from the state, the money will be guaranteed to us. We'll be able to move forward and further augment the rental relief programs with a net of $500,000 generated or provided by the county to serve all areas of the county, and including support in the town of Mammoth Lakes. But we have many communities in the north and the south that are where residents, working families are in need of assistance. And it's our objective to get as much out there to all of them as we can. Thanks.
Thank you, Dan. Thank you, Bob. It's almost the top of the hour, so let's get to some questions. What's our first question?
Have you considered Tom Cage's 3 phases as printed in the sheet dated April 25th? Some good suggestions.
I'm sorry, can you repeat that?
Yes. Have you considered Tom Cage's 3 phases as printed in the sheet dated April 25th? Some good suggestions.
Frank, would you like to take that question?
Certainly. Yes, they are some good suggestions. Actually, we have Tom working with our economic recovery branch to bring some of those ideas into work that actually started back on the 24th of March, about 9 days after we got started in the management of the incident. So he'll have a chance to take those ideas, and they're good ones. spent about an hour and a half on the phone with them the other day to look at ways to integrate that into things that we've already had in place for a while.
Thank you, Chief. Next question, please.
You have mentioned that we are all waiting for the governor to give the go-ahead on reopening, but the state already does not have a closure on hotels and nightly rentals, and other areas of the state have their hotels open. When can we expect that short-term rentals are allowed? If you cannot currently answer with a specific date, when will you have that information? As we, the owners and sole proprietors, need that information to gauge how to handle our upcoming foreclosure notices and HOA delinquencies.
Dan, do you want to take that from the town's perspective?
Yes, thank you. We had put the ability to do short-term rentals in Mammoth Lake through the end of May. That will get reviewed. The two elements to that is one, under the essential worker category that the governor issued, those folks who work to support that industry are barred from going to work. So you should have no housekeeping, you should have nobody serving a reservation, you should have nobody offering a key, should be no support services going into the hotel, motel, and VRBO type services. So that's the restriction in place. There's also a non-essential travel ban. So we should not be inviting people from out of the area to come to Mammoth Lakes. Some are willfully doing that in violation, and they do show up here. But so we're looking, we would hope to be able to move out from that ban by June 1st, but we do not have a guarantee on that date pending action by the state.
Thank you, Dan. Next question, please.
You mentioned last week and today that the Economic Recovery Branch has been doing lots of things to get ready for businesses to open. Could you tell us what has actually been done?
Dr. Boo, I know you've been working with that group very closely. Would you like to speak to that question?
Yeah, sure. You know, basically from my point of view, it's been primarily trying to, you know, develop safety guidelines and standards, but it's complicated by the fact that, again, we don't know whether the state's going to come in with its own ideas about, you know, what businesses need to do in order to be able to operate safer. But we wanted to have something that local business owners could work with. And so they're mainly, you know, working on things for some of the larger sectors like restaurants, retail, and hotel, short-term lodging. You know, working with
Tom, we're getting a lot of feedback from your laptop. Are you able to turn that microphone down a little?
Brian, maybe Alicia could help supplement the points that Tom is offering.
I'd be happy to, thank you. So as Dr. Boo was mentioning, the Economic Recovery Branch has been kind of in operation for about 4 weeks now, and just in a nutshell, we've been looking at all kinds of avenues in terms of supporting our small businesses, of course, and primarily right now we're looking at working with Dr. Boo on a set of return to business guidelines that really address public health and safety for kind of requirements for each business sector. So that document, we've been really working on that, and someone mentioned Tom Cage earlier. We've been receiving all kinds of feedback from prominent business members and every business across the county through the chambers of commerce. And that's been a little bit limited. So tomorrow or over the weekend, we will be sending out this draft document of public health guidelines that Dr. Boo has put together to all businesses countywide. And then we'll gather all of that feedback, revise the document, and then have a business community Zoom meeting shooting for May 11th. We're also working on tourism marketing recovery messages, and so we have a number of things that are going on. And certainly the person who submitted the question is welcome to contact me for more details. Thanks.
Thank you very much. Next question, please.
Can we encourage mask use for some time for everyone so we can get ready for the influx of visitors from out of town?
Dr. Boo, is your system working a little better? Are you there?
Yeah, I'm here. Yeah, so it was a question about general masking or face coverings for the general public, I believe. And yeah, I actually have signed an order mandating that everybody who's out in public, unless they're off in the mountains by themselves, wear a face covering whenever they're interacting with other people, and that's going to go out this evening or tomorrow morning, I think.
Thank you, Dr. Boo. Next question, please.
I saw a notice posted at Glass Creek campsite saying no camping through April 30th. Will this be lifted starting tomorrow, or will it be extended?
Chief Freebolt, would you like to try that question for me?
So we meet regularly with our federal and state partners in the region. My understanding is they have a rolling 2-week review of closures. And for the campsites, I believe the next closure review is going to be 15th of May.
Right. I agree. I think it's been extended through May 15th. Yeah. If that, assuming that's a U.S. Forest Service site, I think so.
All right, thank you both. Next question.
Previous meetings have mentioned possible new guidelines for RV parks. Is there an update?
For RV parks, Dan, would you like to speak to the town?
We don't have a lot here. The ones that we do have is with the forest side, and those are currently closed. I know we've looked at some RV parks in the county, and I'll probably defer to Bob on that in terms of really the regulations looking at the longer stay where people come in and are there for 2 or 3 months out of the summer.
Bob, would you like to add to that?
Thanks, Brian. And I think what we're working on in the county are consistent and similar interpretations and regulation.
Thank you so much. Next question.
Please give us some kind of help. I care deeply about public health, including my own aged parents, and I'm a business owner that is complying 100% with the county's restrictions. I need to hear more information from you, even if it's minute, as to when the county expects to start to reopen, what guidelines in phase 1 and phase 2 of Mono County's path forward reopening Mono County in phase have not been met.
Chief Freebolt, can you please answer that question for us?
I will do my very best. So one of the things that's confusing, we have state and federal uses of the word stage and phases that are not all the same. Where we're at now is we have met, Dr. Burrows and who have met in a clinical setting and have agreed that we have met the requirements to move to what would be consistent with the state's stage 2 level, which the governor said we're not there yet, but we're weeks away, not months. And so those are two things I would point out to say that they're closer. The governor's statement, we're not months away, we're weeks away. And the fact that we've done a dashboard review of those items and we're ready, as you've heard Dr. Burrows say, and we've mentioned several times. So again, we can't manage to a date. Can't tell you what the date are, but the conditions appear to be weeks away, not months away. So if I, weeks away, not months away. I don't know how else to say that without trying to pull a calendar out, and we cannot get ahead of the governor. But I'll tell you certainly we are 6 weeks closer than we were before. So I think we're close. Stick with it. Help us meet the intent. We're getting close.
Brian, can I add something?
Absolutely.
So as Chief Freebolt is saying, I would love to give everybody a date. I think we would all love to give everybody a date. But the goal here is everyone's got to stay patient and we all have to move together. And we have to be moving with the idea that we got to be smart when we make that next step forward. Because if we're not smart, if hotels and restaurants and bars open ahead of other areas and we have congregating, we're going to see more cases, we're going to surge. And that is going to be one of our criteria to say we're going to have to dial everything back. And nobody wants to do that. So we want to make sure that as we do this, we are all moving together. We're all respecting and following all the rules that we put out. And I say the word rules loosely. It's like, look, we got to be 6 feet apart. We got to still wear masks. We've got to be smart about how we go to stores. If we don't feel well, maybe that's not the day to go shopping or go to the restaurant when it's open or whatever it is that's now slowly open, to be mindful of the fact that we expect some increase in cases. There's just, I don't think there's any way that's possible. That's not going to happen, but it's got to be at a pace that we can handle it, that we can take care of people. Right now we're in that situation and we got to stay there. I think we can do it. I think we're smart enough, resilient enough, and we can make it happen. But this idea that we have a date and then we're going to go is not the way you have to look at it. We have to look at it with all the conditions are met. Everyone is for the most part on the same page, and we're moving together as a unit and not as individuals.
Thank you, Doctor. I believe Chief Rebolt wanted to add something on. Go ahead, Chief.
One other quick item. Remember that as a tourism town, we're going to compete with other tourism towns. We can't avoid the fact that the virus is here and that it'll be with us for a while. But what will separate us is a definitive statement that we are more prepared to bring people safely to our community than others are. And we're going to be ready to make that statement. So stick with us. As Dr. Burrows said, stick together here, arm in arm. Don't go racing out in front of each other. We're going to stumble. So weeks, not months. Help us meet the intent. We're going to get there.
I want to thank both of you for that. I did notice sort of a mental health component to that question. I was hoping that Robin could chime in if she's on the line.
I am. Is this the question about hope?
About hopelessness, yeah.
So my name's Robin. I'm the director of Mono County Behavioral Health, and I'm here. I'm listening to these conversations, and I think what I'm hearing and what I know about what's going on in my community is there's a lot of frustration right now. People are really worried and scared, and all of these people here that are talking to you tonight, they work daily on this, like literally daily, hours a day, every day, 7 days a week, trying to make sure that the best medical knowledge is helping to make this decision, the best knowledge around what is possible economically, and then following state and federal guidelines. So I think there's reason to have hope in what they're saying, but at the same time, what we're noticing, and I know that a lot of the questions, because I can see the questions are about frustration about what we can't enforce, because what we're noticing is that our neighbors and loved ones and friends aren't necessarily following the rules anymore. And so I have two things to say. One is, this is about our community. And this virus, this is not scientific. I'm not a scientist in any way, except for maybe my hair is kind of Einstein-y. This virus lives in the air. And so right now it seems to be that at least in the neighborhood that I live in, there's kind of a badge of courage if you don't wear a mask, that somehow it's showing that you're, I don't know, a little more together or macho, or like you kind of moved on from this virus problem. What we need is for you to recognize that this virus lives in the air and that we can protect each other and keep this going. Like what we're talking about here isn't just about opening businesses. It's about putting essential workers back into physical locations where they are going to be potentially exposed. So right now, what we can all do is wear a mask. Wear a mask when you go to Vons, wear a mask when you go to the grocery outlet or whatever, wherever you live in the county, wear your mask so that you're showing that you really support your people. Right now, we are seeing on my side of the world, which is the mental health world, we're seeing a tremendous amount of stress. It's not just economic. It's because we have been disconnected from the things we love, and it's because we are being disconnected from the things that make us feel good in the world, and we have a tremendous amount of disappointment right now. And so what people do with that, I think what we're seeing is people get mad. And we get mad and we say, screw it, we're not going to do this anymore, this is stupid. We get mad and we say, we're really mad at the people that aren't doing it anymore. How about we all start to just focus on another thing? Let's make connection with each other. You know, right before the COVID hit, we had 6 suicides in 7 months in the town, in Mammoth. We had climbing deaths. We had a hantavirus death. We should all, at that time, people were really talking about disconnection and loneliness. I don't think that's changed. So right now, what we can do is make connection. And I don't mean physical connection. I wish I could do that too. I have as much disappointment and as much frustration about this as anybody else. And I'm doing what these people are telling me to do because I want to stay safe. It's not just that I could die of this. People get really sick. And I'm doing the best thing because I care about my community. And so let's rally. Let's do that. Let's make connection by caring about Mono County, doing what we need to do right now to get through this next part and continuing that. It's not like the masks go away. Once we start to open, we have to be even more diligent about how we take care of each other. So make connection with each other. Trust the people that are talking to you here. Know that behind the scenes, more work than you can imagine is going into this. We are as worried and frustrated as you are, and we're trying to do this in the best way possible. If you need help, if you want to talk to somebody, if you're living in an environment where you are not safe, you can call us any time of the day or night. Our number is 760-924-1740. Just give us a call. But in the meantime, this is about caring about each other. The more you follow the rules now, whether you like them or not, you don't have to like them, the better off this whole process is going to go. Thank you.
Thank you so much, Robin. Next question, please.
With the warmer weather upon us now and the increased traffic on our local trails, when can we expect the MLTS trail crew to begin working on trails? There is a definite need to expand our trail access right now and to help with physical distancing.
Dan, can you speak to that?
Yes, thank you. The Mammoth Lakes Trail System does a lot of work out on our trails. The only work currently authorized is essential, deals with the fire crews who are doing some high-risk areas for tree removal and some elements of that. They've got permission out of their leadership at the state to be able to go and do that work. They have to practice all the same distancing and other elements that are in place. The actual work that the town supports and funds through a couple different ways out there and maintaining the trails currently really doesn't qualify underneath a construction project or some of those elements of essential workers. We are looking at gearing up and being ready to go just as soon as we can, but it may be out a few more weeks yet before we're out on the ground doing the work that we would love to be out doing.
Thank you, Dan. Next question, please.
Since motocross is canceled, are all events going to be canceled?
Dan, I refer back to you.
Thank you. No, we don't know in terms of a lot of the events that are out there. We believe that some will be able to go forward later in the year. We're anticipating, again, there's a whole issue of that in some of the governor's work and the stages. It's going to really depend upon the size and scope of what those events are, the ability to maintain social distancing, the ability to provide for sanitation issues, hands and stuff of that nature, as well as regular facilities, and being able to monitor those things in a safe and healthy way that meets both public health guidelines as well as making sure that we don't have the potential for the spread of disease to start again. We don't know what those guidelines will look like exactly. We're looking at some elements for that as the best guess that we can make at this point, but there's no guarantee on the timing when those will be able to move forward. We have canceled our normal July 4th events, for example, parade and fireworks and those types of elements as well. A marathon has been canceled because of those types of standards of bringing that many people together. Just are not going to be able to meet the guidelines we see out there. The CDC guidelines for a larger group is 250 people. We've looked at other guidelines that may push that down to 50 people once it is actually available to be done.
Thank you so much, Dan. Just as a reminder, we have 15 minutes left in our community meeting tonight, so let's go to the phone lines.
Okay, first question is from Monica. Go ahead and unmute yourself, Monica.
Hi, thank you. A few weeks ago, the governor announced a disaster relief fund for undocumented workers. And so they'll receive a one-time cash payment of $500 per adult and $1,000 per household. And I believe it starts in May. Do we know where the undocumented members of our community come and apply for this program locally? And my second part of that question is, do we have any additional financial assistance here for undocumented workers? Because that's really not even half of what the rest of us are getting on our federal stimulus, and they don't qualify for unemployment as far as I know. I'm really concerned about a large subset of our community that's. I would just like to know what we're doing for these members of our community. Thank you.
Dan and Bob, can you field that question?
I can speak to some of what we're doing on I'm not sure how the funds will be administered, referenced by the governor. The individuals in the community who are not documented and have that concerns, our food bank program, I don't believe makes any distinction. It's just looking at, have you been unemployed here in the community? And our rental assistance program makes no request or distinction on your citizen status or documented or undocumented. So those programs are available.
Thank you, Dan. A couple of points. The funds referred to by the governor are being administered essentially from Sacramento through local nonprofit organizations that have experience working with immigrant and undocumented communities. We haven't been advised yet what organization will be tasked with supporting those communities in Mono County. And I would certainly be willing to defer to anybody from our social services department that has better information. One other area that I want to remind folks about in terms of service for our communities is IMACA, the Inyo Mono Advocates for Community Action. On the web, they're at imaca.net. Their phone, and they provide services in English language and in Spanish language as well. And there is no restriction on who can come forward and seek help. Their phone is 760-279-4350, 760-279-4350. And if there's anyone from Mono County Social Services or any of our other agencies that has specific information, I certainly welcome your input here and now. Thanks.
Thank you, Dan. Thank you, Bob. No one else seems to be chiming in at the moment, so let's go to our next call.
Next caller's phone number ends in 4508. Go ahead and unmute yourself.
Thank you. Actually, the question's already been answered, I think, tonight regarding short-term rentals and starting around June 1st. Let me just first thank you all for the information every week's been very helpful and keeping the community involved in what's going on. We for one, as business owners in the area, appreciate that. I know it's an uncertain time, and just thank you very much. So because the question's already kind of been answered about the June 1st and kind of the uncertainty and kind of reviewing this every 2 weeks, just I guess more of a statement of, being able to ramp up as a business owner and having as much information as we can, as soon as we can, to be able to welcome guests back. So thank you very much.
Thank you for your comments, and we will get that information out as soon as we possibly can. Next question.
Next caller is Greg Vane. Go ahead and unmute yourself.
Hello?
Yes, we hear you.
I'm sorry, the last name was incorrect, so it caught me off guard. I think that the governor has made it fairly clear that when he does start reviewing the stay-at-home order, and he's going to relinquish it by regions that are doing quite well. For example, I think Los Angeles may be one of the last, and I'm not suggesting that we join the 6 counties that have requested to open now, but a couple of days ago at the Board of Supervisors meeting, John Peters led a charge that we should draft a letter and send it off to the governor, like Dr. Burrows said, letting him know that we feel like we've crushed the curve and doing very well. Is that something that is still being considered?
Brian, if I may?
Absolutely.
I'm very happy to report that we do have precisely such an item on the May 5th agenda for consideration and action by the Board of Supervisors. We have a couple of sample letters from other counties for the board to review and consider. And without not being a member of the board, I can't guarantee a particular course of action, but I do believe that they have every intention of pursuing that course of action.
Thank you, Bob. Next caller, please.
My apologies, Greg. Next caller is Greg Vane. Go ahead and unmute yourself.
Is the caller there?
I'm here. Can you hear me?
Yes, go ahead.
Great. Sorry about the technical difficulties. I have an observation and a comment, or maybe suggestion, that picks up on the dialogue between Dr. Boo and the person who phoned in earlier asking about the mask topic. And it also picks up on a very diplomatically worded observation by Frank about a lot of our friends down in Southern California haven't quite come up to speed yet here in terms of following the recommendations for distancing and masks and so forth. Saturday, my neighbor across the street here in the Knolls went down to Do It Center to pick up something and get out to finish a project at his home. And he said the line stretched from the front door all the way to Looney Bean. Half of the people in the line had no masks. There was a person at the door, presumably an employee, who was letting one person in for every person who left. And occasionally he would tell the people in the line, if you don't have a mask, you can't come in the store. So that was good, but the fact is that half of the people didn't have masks on. And that same day, as I was doing my run through the neighborhood up here in the Knolls, probably half of the non-full-time occupied homes up here had people in them. So clearly a lot of folks were coming in from out of town. I mentioned this to my wife, who's sheltering in place in Pasadena, so she can go to JPL once a week to drop and pick off stuff for her work. And she said, well, that's really interesting, Greg. She said, here in Altadena and in Pasadena, every store that is open has a big sign. They all say the same thing, same format, out in front that says very simply, no mask, no entry. And she doesn't know whether the stores did this on their own or whether the towns of Altadena or Mammoth did it for them. But the fact that they were uniform signs suggested to her that the municipalities had perhaps provided these big signs for the windows for the businesses which were allowed to be open. So I'm wondering if you guys have thought about that, or if it's something that you might want to consider doing, particularly as we prepare for the influx of folks who are coming from out of town who may not be quite, as diligent as we are here in Mammoth about following these kinds of rules.
Dr. Booth, do you think you could address that question?
Well, the order that I signed today requiring masking for facial covering for everybody would, basically, everyone would be required to have a mask on to go anywhere to the store. I mean, you're allowed to go hiking in the mountains by yourself. You're allowed to go for a walk with members of your immediate household, but otherwise, you're allowed to be in a car by yourself without a mask, but otherwise, everyone should be wearing a mask.
And if I could just add to that, businesses are allowed to require such things, such as, you've seen the signs, no shoes, no shirt, no shoes, no service. It's basically along those same lines and principles.
Right, but now they'll be required. I mean, everyone will be expected to have a mask.
That is our recommendation, yes. Next caller, please.
Brian, it's not a recommendation. It's an order now.
I'm sorry, it's an order now. Go ahead, Dr. Boo.
No, I just want to clarify that. That's all.
Yeah, and I apologize. So it looks like we have about time for one more caller. So can we get our last call?
We actually don't have any more calling questions, but there is one more question in this, in the typing questions.
Okay, go ahead.
I am a second homeowner, but I stayed away since March 15th. I stayed in place in LA all this time. LA will get testing for everyone starting today. Should I be safe to come up given these circumstances?
Dr. Boo, can you answer that one?
Well, you're supposed to stay home. I mean, if you were here, you'd be totally welcome as a second homeowner. But our interpretation of the governor's order is that wherever you are, you should stay there until the governor modifies the order to make it permissible to travel. I think there's risk of COVID-19 everywhere, but the risk in Mono County right now is not very high.
Thank you, Dr. Boo. And I'd also like to thank all of my panelists that are here tonight. Unfortunately, that's all the time we have for this evening. So until next week, take care of yourselves and each other. Thank you.